Hello, my name is William Trammell, and I am going to be discussing healthcare in the United Kingdom. So, healthcare has been a popular topic over the past few years, especially with Gen Zers in the United States. Especially the topic is moving towards a more universal healthcare system, a more socialist system in terms of healthcare, making healthcare available for everybody instead of just people who have insurance in the United States, which makes it difficult for some. So I just want to give some facts about the UK and their system. And yeah, so the UK is not just England and London like we all think sometimes. It's actually made of Wales, Scotland, Northeastern Ireland, and England. So there are several territories that are a part of this system. The population of the UK is approximately 67 million, and that's about a fifth of the US's. So very interesting. We'll touch back on that later. They do have universal education, which is great, which is said to be attributed to their high literacy rates, which we love to see in modern societies. The GPD is 2.662 trillion US dollars, and the healthcare system in the UK is called the National Health System, or the NHS. So we'll be discussing more about the NHS as we go further on and how they affect their healthcare system. All right, politics and healthcare. So the NHS began after World War II, first proposed to Parliament in 1942. So an interesting fact, I guess you can see about the universal healthcare system in the UK is that 18% of paid income goes right towards your healthcare. So you don't have a choice. All of your 18% of your paycheck goes right to healthcare, which some people would love. I think a lot of people don't always understand that you still have to pay for the healthcare system, even though they say it's universal and free. So I guess that's the trade-off: is it taken out now? Is it taken out later? 18% of it is taken out immediately out of all your paychecks in the UK, going right towards your going right towards healthcare, which is, I guess, helpful for people who can't track their money, and it's very interesting to see. 8.4% of the nation's GPD is spent on healthcare, so that's actually pretty high, especially compared to the United States. The structure of the program is ran slightly different in different parts of the UK. So that is true. Depending where you are in the UK, it depends on how well your healthcare is covered and what things are available to you. So I suppose that is interesting. That's also due to like the number of workers that are in that part. So in Wales, for instance, there's not as many physicians as there is in deep England. So, and there are over 290,000 physicians in the UK. That number I actually think is pretty interesting because it's only about half of what the United States has in terms of physicians, but they also have a fifth of the US's population. So it's interesting to see the argument of like, if you move towards universal healthcare, there'll be less physicians, less doctors, etc., when they have a pretty high number of doctors per person in the UK versus the United States. So very interesting to see that. So healthcare in the UK, according to the WHO, or the World Health Organization, 85% of healthcare is provided by the NHS, or the National Health System of the UK. The other 15% by private insurance. So there is still private insurance in the UK, but it's definitely not as common and as if you come over here. So the NHS sees 1 million patients per day. They have no problems with that. Experiencing a chronic doctor shortage. So although they do have a lot of physicians in the UK, especially compared to the US, there is still a high demand for healthcare and for doctors. So they're always looking. They're always kind of at a shortage, which I guess is a little scarier when you compare it going to like the US. I don't know if it's the US just being able to work with their doctors better, but there is still a shortage in the UK, mostly in special physicians doing special surgeries. Care is available universally on the basis of need, not the ability to pay, and is funded by taxes. A belief that many people believe should be universal, and it's interesting to look at. The NHS is the largest employer in the UK with over 1.7 million employees. So that means that most of the population of the UK that's working for one organization is working for the government, is working for their healthcare system. So it is interesting to see them collaborate in something so big, something that's bigger than them. I think it's great. All right, access to care. So some facts about the national health system in the UK is they have short waiting times, primary care and emergency services. So you break your arm, you need some stitches, no problem, it should come real easy. There should be no problems getting any of that. Specialized care, on the other hand, in elective surgery, that's where you have longer wait times. That's where you're having a shortage of your doctors as your specialized physicians. So you want to get heart surgery, you want to get something along those lines, you're going to be waiting a while. That's why a lot of people who have money, who are in these universal healthcare systems, move over to the US just for a bit to get the surgery because they know they can get it fast because you're paying a lot of money for it, but at least you're getting it. So in different parts of the UK, certain parts won't be covered, like dental or eye, or some prescriptions or some spine and abdominal supports. So it is interesting to research where you're at in the UK, what parts of healthcare are provided for you for free. So you do got to take into account that you're paying for it, but that it's universal. So it's not always easy to get all these things. Often the dental care system is attributed, their poor dental care system is attributed to like the US's view of the UK's teeth, which is silly in a lot of ways because it's definitely not all true. They definitely don't have that bad of dental system. It just depends on what part of the UK you're from, or people just choose not to do it. Preventative medicine is free and offered by general practitioners. So another great thing that they have, just preventative medicine that's needed for people. Yeah. All right, the English system, or the Care Quality Commission, is used to evaluate hospitals and give ratings. Patients can report concerns to Patients Advice Liaison Services, or PALS, and the Picker Institute monitors patient satisfaction. So those are just some organizations to look out for when you're looking at the UK's healthcare system, and those are my references. So that's it. Thank you.